Okay, so now we've got Mr. Sunil Budia, who is co-lead of the cardiac surgery at the Royal Brompton and Hayfield Hospital. Sunil, you're a cardiac lead, and your team brought in Huma to help during the pandemic. It'd be great to get insights from you on what were some of the challenges you were trying to meet, and how did the system work for you and the team, and is it making a difference?
Sure. Thank you, Harpreet, for the introduction. As you mentioned, I'm the co-lead for cardiac surgery at Hayfield Hospital, and we work very well with the Huma, and I'll tell you how it all started, and how we have collaborated since we started working together. So at the beginning of the pandemic, which was around March of last year, we came to realize very quickly that the world is going to change, and more importantly, the world for patients was going to change, and how we work as well. So across London, Harefield was tasked to look after cardiac surgery patients across London together with Barts. So out of the 7 units, two units were tasked to undertake operations. So you can see straight away from a huge number of centers doing the surgery, only 2 centers were doing surgery. And then doing the operations and the logistics of the operations, getting surgeons here was not an issue because we've done that in the past and we are happy to do that. But what started becoming very clear to us was how are we going to monitor our patients? Because there'll be loads of patients sitting at home waiting for their surgery, and we didn't have the capacity. So we had to reclassify each and every patient as to their urgency for the operation, and ensure that those who are more urgent had their surgery first, and for obvious reasons. But again, we also wanted to find out those patients sitting at home, are there any of those patients deteriorating? So one option was for us to call them up and ask them how they're doing, whether their symptoms are getting worse. But it became quite apparent that by the time we reached the last patient, we will be calling the first patient up again to see whether that patient has deteriorated or not. So the obvious answer for us was to look at other technology, and Huma is where Huma came in, because Huma had the technology to monitor patients on a virtual format. So we gave patients a login and certain symptoms that they could take, and to see whether they were flagging up on any of those symptoms. But more importantly, were they deteriorating? So most of our patients get chest pain, but we wanted to know, was that chest pain getting worse? They get shortness of breath. We wanted to know whether they're getting worse or not. Because if they did that, then we had to reclassify their urgency. So just giving you some numbers. So over a 6-month period, we with Huma, we had monitored 525 patients. And of those 525 patients, 10% of the patients showed deterioration. So clearly that's a big number. So that's over almost 60 patients. And of those 10%, almost 90% of the patients, we had to bring their surgery date forward, and so that we could operate on those patients in a timely manner. And this served, the platform served multiple purposes for us. One, it was for us to get reassurance that we're monitoring our patients, but also for the patients as well, because patients were afraid to go out. It was a new world for everyone. They didn't know what was happening out there, but also for them to get reassurance that someone was keeping an eye on them, just in case if they were to deteriorate, then they could flag that up, and someone would call them up to follow them up and get their surgery expedited. We also realized that it's not only the pre-op that we are interested in, we also wanted to see what we could do post-operatively, because we could not get patients into the hospital for for their outpatient clinics for us to review them. So we used the Huma platform to monitor our patients in the post-operative period as well, which was good success. And if patients had any concerns, then they could flag that up on the platform, and we would get in touch with them sooner than we would have otherwise contacted them. So normally we contact them at 6 weeks. We would contact them sooner, and some of the things that we did after this monitoring was we would modify their medication or look at their wounds, get them in to look at their wounds, or virtually we would look at their wounds. So these are the various tools that we used together in collaboration with Huma for improving the care for our patients.
Brilliant. Very good, Sunil. So obviously quite a lot happened there, and quite a number of different use cases that you demonstrated. So it seems like it's been quite a interesting experience for you. I just wanted to ask a couple of questions on the back of this, if I may then. So firstly, I mean, have the results surprised you? And linking to that, do you feel that the experience that the Royal Brompton has had, do you think a similar approach could benefit other cardiac centres and networks across the country?
Sure. The results, obviously, we don't have any other results to compare with, but these were quite encouraging. Encouraging in the sense that not for the patient that they're deteriorating, but encouraging that we can identify these patients without them having to come to us. So in the past, we would have relied on us making a phone call to the patient, or patient going to the GP, and then the GP getting to us. So we are sort of shortening the length of time it takes for a patient to get in touch with us to tell us that something is not right with them. So 10% is a big number, and if we can escalate the operation and get them done sooner, then we've saved quite a lot of lives like that. As you appreciate, cardiac surgery can be life critical, and if we get it done in a timely manner, then that would save lives. The other thing is also for the symptoms point of view. If the symptoms are getting worse, they're not able to do things that they are able to do. If we can bring their operation surgery date forward, then of course that would benefit them. But if you look at the scale of the problem, we can't call every patient up. It's just time consuming. This is a more efficient way of doing it. We have suggested this to the Pan London group, because we have a Pan London cardiac surgery group, and they have taken this as an exemplar sort of way of monitoring patients. So other hospitals are considering this, and we have been encouraging them as well, because this is the way forward. And as I've said, we also want to look at other avenues of monitoring patients post-operatively as well.
Yeah, no, very important, and it's good to, well, encouraging to hear that that's obviously being looked into now, and other centres and hospitals are looking at this as well as, like you said, the positive results that you've seen. Well, and then the second question I had on this is that, do you kind of see, or could you see similar digital tools that benefit other pathways? So obviously we've got cardiac, but other surgical specialities or other kind of pathways that can help support the NHS recovery.
Yes, I mean, cardiac surgery, if you look at the number of patients waiting for cardiac surgery, is probably small compared to, say, for someone waiting for orthopedic surgery, hip replacement or knee replacement, someone having eye surgery. Those are big number of patients. So if we can monitor these patients in a more, as we've shown that this is a more efficient way of monitoring patients, and it's less labor intensive, and we know that it works and it flags up patients who are deteriorating. So if we extrapolate that to not only cardiac surgery in the rest of the country, but if we extrapolate that to other types of patients, like we mentioned, orthopedics, eye surgery, then we will free up staff who are trying to monitor these patients to do other important things in the NHS. As you know, NHS is struggling with staff recruitment and also the number of staff working. So this will help free up staff to sort of spend more time on where they're required. So it has a big impact. It has potential big impact in other specialties as well.
Brilliant. Thank you so much, Sunil, for your insights and your time. And it's really great to hear some of the results of this, and we look forward to hearing more further developments as they come along. Thank you, Sunil.
Sure, it's been a pleasure, and keep at it. And I think we'll do the right thing for the patients.
Thank you.